since having a revision surgery for flatback syndrome, amongst other back issues. Um, Life kind of got really busy because I returned to work just weeks into my recovery, and pretty quickly the weather changed and I became much more restricted to just being at work and being at home, and finding physical therapy became a challenge as well. So I've been just working through some of the I guess mental limitations brought about by this surgery, and the recovery. But I know that there are many more people out there who are looking for information and who are hoping to make informed decisions about whether or not they should have surgery. So I figured this was a good time for an update. So right now I'm actually on a walk. So I'm at the park, and I've been walking for about two and a half miles today. Pretty pain-free, I have to say. Yesterday I walked 4 miles, mostly pain-free. And when I say pain-free, I'm referring mostly to the pain that I was experiencing for many years before the surgery, which leading up to the surgery, I have to say, was becoming unbearable. So anyway, I've walked about 2.5 miles today. I think when people say that walking is the best exercise, they're not being simplistic about it. They're not oversimplifying the road to recovery. Walking is by far one of the best things that I've done for myself, and not just walking on even ground, but on different terrain, more difficult terrain, as I become stronger and more stable and more confident and less fearful. I think what I want to talk about for now is the need that there is for adequate rehab, physical therapy and rehab. For the most part, I think I've had to do my own. I live in New York City, so I have access to a lot of therapists, and I did end up seeing many of them, about 5 of them, I think, but really didn't find anyone who I felt was familiar enough with my condition, with my limitations, with what I needed, or someone who was willing to learn with me. It's a very quantity driven field, so getting one-on-one time with a therapist is hard to come by, unless you're able to pay out of pocket or go out of network and pay out of pocket. So I've been doing a lot of walking, as I said, on different terrains, up small hills, on uneven ground, very carefully, of course, and slowly, and have been doing stretches at home and just kind of easing into day-to-day activities that I was able to do before. Yes, in a lot of pain, but I never became, passive. I didn't stop working before the surgery. So I kind of made up my mind before the surgery that I wanted to return to being fully functional as closely as I possibly could, um, in the same way that I was before the surgery. So, um, I've done everything from getting down on the floor and doing, exercises on the floor that I know are not going to hurt me, um, to doing exercises on a massage table, standing exercises, walking exercises. Um, and, I think day by day I'm feeling stronger and more confident. And there are these markers that I've noticed are pretty prominent, if you're aware of your body, and if you pay attention to the things that maybe you couldn't do today, or rather that you couldn't do yesterday, that you can do today. So I've noticed that I've been able to do a little bit more every few weeks, more comfortably, more confidently. But anyway, physical therapy, it's hard to find. What I've ended up doing in place of that has been also, I've been working one-on-one with a Pilates instructor. If you would like to know more about that and how it's been, my limitations, my needs have been approached and addressed, I can definitely make another video about that. I'm new at this. I'm really not at all like a video camera kind of person. If I can make videos that are about specific things, I think I'll not ramble as much. But anyway, I think I'll end this video by saying that there are positive outcomes out there. I think I'm a good example of that. Of course, everyone's body's different, everyone's situation is different, but there are a lot of stories out there about, horrific outcomes after a revision surgery. And I'm sure that is the case for many people, but there are also really, positive outcomes that are not, like picture perfect, because I'm by far, not feeling perfect or perfectly myself, but in many ways life is significantly better than what it was before the surgery. I'm still only 9 months into my recovery, so I still have ways to go, but I think that I'm moving in the right direction. So anyway, thanks for watching this video. I'm here to answer questions, so feel free to post your questions in the comment section, or to request a video about any topics that you'd like to know more about. One other thing I want to say is that I did a tremendous amount of research leading up to my surgery.